I'm Kevin Puni, a medical oncologist working in the University Hospitals of Leuven, Belgium. I'm very happy to share the results of the health-related quality of life study that was recently presented at ASCO. And this analysis is a subgroup analysis of the phase 3 ASCENT study, which was a randomized open-label study investigating the efficacy and safety of sacituzumab govitecan versus single agent of chemotherapy choice in pre-treated advanced triple-negative breast cancer. And as you know, this study has showed that treatment with Trodelvy significantly improved progression-free survival and overall survival. But a key outcome of clinical trials, especially in this incurable setting in oncology, is also the impact on the patient-reported outcomes. And it's therefore that this health-related quality of life study has been performed. So the objective of this study was obvious. We wanted to see the evolution of the quality of life and check whether there were significant changes between patients randomized in the experimental arm with Trodelvy versus those randomized to the control arm with single agent chemotherapy of physician choice. And actually the results were really reassuring. So when we looked to the primary global health-related quality of life aspects, we could see that there was a significant and clinically meaningful improvement in health-related quality of life scores for patients treated with Trodelvy as compared to those treated in the control arm. And this was relevant for the global health status, but also for physical functioning, emotional functioning. And also when we looked into the specific symptoms that patients can have when we treat them for a disease like advanced triple-negative breast cancer, we saw a lower symptomatic impact of fatigue, of pain, but also of dyspnea in patients treated with Trodelvy compared to patients treated with single agents of physician choice. And the only symptom that was significantly and meaningfully worse in patients treated with Trodelvy was diarrhea. But this is a very well-known side effect of the drug. And despite this diarrhea, this does not impact in an adverse effect on the patient global health status score of functioning. Colleagues that do not yet have experience with this new drug are, of course, interested to know what the safety profile of the drug is, since it might not always be that easy to assess this from the safety tables from a phase 3 trial. So the colleagues are really interested to know how this impacts the patient-reported outcomes. So the general aspects of this analysis showing this clinically meaningful improvements for patients treated with Trodelvy or important findings that are discussed among colleagues and that can leverage and increase actually the value of a specific anti-cancer treatment. And this is really happening with Trodelvy based with the results we see here today. And for example, this can also impact some important scoring systems that are used in the oncology community to score the value of a new treatment. For example, the ESMO magnitude of clinical benefit scale incorporates the health-related quality of life data. And when, as we see in the subgroup analysis of ASCENT, the global health-related quality of life significantly improves with a new treatment as compared to the standard treatment, this results in an additional score which would result for Trodelvy in reaching the maximum score on this clinical benefit scale for anti-cancer treatment in an incurative setting. Well, we know that the efficacy of Trodelvy has been explored in several treatment lines. So starting from the second treatment line onwards towards patients who had really received several prior treatment lines, it has been shown that Trodelvy is active in all these settings, but taken into account also the supportive quality of life data. The bulk of the data, I think, points towards a more earlier use of Trodelvy in patients with advanced triple-negative breast cancer from the second line onwards. And I think that these reassuring findings can lower the threshold that some hesitating physicians could have to use the drug early on, as soon as it's in label and it's available. So I think that the uptake of Trodelvy will further increase based on these results. We have to acknowledge that it has already been considered in places where it's available, a new standard of care. As said, the results of this research will likely to be leveraged in the magnitude of clinical benefit scale, and we can hope that this will result in a maximum score of Trodelvy in this scale, which actually can be used as a physician, but also by authorities to prioritize treatment and make decisions when it comes to reimbursements. It stays a very important aspect in the incurable setting that we do not only want to improve outcomes, but we also want to improve the quality of life, since we are in an incurable setting and the quality of life as perceived by the patient stays one of the most important aspects to assess the value. So I want to encourage all my colleagues to consider pre-planned health-related quality of life evaluations in similar settings to strengthen the bulk of data we can rely on to be confident in saying that Trodelvy is the best treatment option for patients who fall into the label with advanced triple-negative breast cancer.